precision medicine. That means customized, individualized cancer care, that one therapy does not match the therapy of another patient. Today we shall talk about this. Hello friends, I am Dr. Rajeev Vijayakumar. I'm a consultant in medical oncology at BGS Gleneagles Global Hospital, Bangalore. What is precision medicine? Can we actually have a separate therapy for each patient? Yes, it is possible. That's where genomics has played a role. So now you know that let's consider if you go to a doctor for a cough cold, there are a certain set of medicines that you would give. Whether it is a thin person, heavy person, you may just change the doses. Antibiotics, thin person, heavy person, frail, you will just give different antibiotics. For pneumonia, you will have a set. Then after for loose motions, you will have a different set of drugs. For cancer care, this was the norm for all of these years. In the last 5 to 6 years, there's been a giant leap in how we perceive each cancer. Each cancer is dealt with in a different way. How do we do this? I'm sure all of us have heard about the cell, the DNA. So every tumor has a DNA. This DNA is like a Google map. It's like if you open the Google map you want to go from Coxtown to Mysore Road, it will show you multiple routes, multiple pathways. It will show you where there is a blockage, where there is a bridge, where there is a construction work going on, where there is excessive traffic. So similarly, when you actually unravel the DNA of the cancer cell, so that is you take a biopsy or you take a peripheral blood sample, you identify the cell-free tumor DNA. Then that is studied. Once you study it, you multiply it, you increase the number of copies that are there. Then you are able to actually put it in perspective and see what are the perturbations or what are the different active pathways in that particular cancer. Once you're able to identify that, you know that, okay, this pathway is on overdrive. This is a driver mutation. Oh, there is a block in this particular pathway. So then this has to be changed. So you know that certain medicines would work on certain pathways. So giving those specific medicines for that cancer at that point in time, you will be able to treat the cancer more effectively. So what does precision medicine hold for us? You would be able to identify the right drug to be given for the patient. So we all know that any form of therapy that we give, whether antibiotics or chemotherapy, will have some side effects. It's not that the side effects are unmanageable, and it also comes with certain costs. There are certain less expensive drugs and there are some very expensive drugs. For us to know which drug is going to work, apart from the physical toxicity, there may be some financial toxicity. To ensure that none of these toxicities are there, by doing certain tests upfront in the tumor, you identify that this patient would work well with, or this patient would respond well with this particular drug. And when you give the correct drug for the correct patient, the response is better overall survival, better progression-free survival, patient has less toxicity, patient is happy, the doctor is also happy. Now, for more on precision medicine, do follow our videos. We'll be coming up with a video specific for how precision medicine is done. Signing off, your friendly neighborhood medical oncologist, Dr. Rajeev. Thank you.